Thank you, Chairman Cox, and good afternoon. One of the great challenges as we work our way through this new normal and the realities we face with coronavirus is at times it's cast as a choice between are we tackling the public health crisis or are we tackling the economic crisis? And the reality is you have to do both. We cannot have a healthy economy and we cannot get folks back to work if we don't slow the spread and have the coronavirus spread under control. And so we have to be mindful that it is not a choice between one or the other, but the two actually go together. They're complementary to one another. We want to get our economy back up and running. We want to get folks back to work. But in order to do that and do that successfully without interruption, we're going to have to come together as a community to really focus our efforts around all of the things that we need to do to slow the spread. Another part of that is recognizing the great difficulties that a lot of entities are facing. And you've seen a lot of action, both by our county in terms of some of the things Supervisor Cox just mentioned, along with things the state's doing and the federal government's doing to support our businesses as they try to get back to work, and in particular to support our workers that have been negatively impacted by what's happened. But I think yesterday the board took a very positive first step in recognizing that you cannot have a thriving and healthy economy. You really can't have any economy if we don't address the issues of child care. And so yesterday, the board took the first step in allocating the majority of the new money to two proposals that we brought forward. One around making a $25 million investment in helping our child care providers. Since March, we've seen more than 600 child care providers close their doors. They are facing tremendous difficulty as they try to get back up and running with limitations on the normal number of kids they have, with the physical distancing things, with what they need to do around PPE. And so I think making an infusion into an effort to provide regional help and support to really strengthen and build up our child care capacity is not only good for those entities, but the reality is you can't expect parents to go back to work if there is not available and accessible child care that's in a safe environment, and I think that's an important step. The other action that we took around testing was to make an initial commitment, or the first step, we'll come back at our next board meeting to ratify it, around dedicating money for testing around schools. I know there's been a lot of conversations and discussions around school reopening. Obviously, we're working with our County Office of Education, with our various school districts here in San Diego County, along with the state of California, to come up with the guidance and the framework around what those schools will look like and what configuration they may be. We're also in a period right now where we're dialing back, but we have to prepare in hopes that we do slow the spread and we begin to continue on our reopening and moving forward for the eventuality that schools will come back in some form or fashion. And so we've been working very closely, my office has, with the school districts, with the county office, with superintendents, along with some of the best minds around testing, about what we could do to provide some measure of maybe surveillance testing, perhaps wastewater testing, maybe some combination of bundling testing, some dedicated diagnostic testing, maybe for teachers and staffs. But we're brainstorming, we're working, a lot of folks are working very hard to try to put in place some system that would give us the best opportunity to monitor what's happening. And so I'm grateful for the Board of Supervisors for taking, again, the initial step that we need to take to address the public health aspect around testing in our schools. Both of these measures, I believe, go a long way to helping ensure our economic recovery can be real, and just the simple recognition that if there's no child care and there's no school, there can be no realistic expectation that folks can go back to work. And so we think these are vital components not only for our public health, but also are vital for our economic health. And so we will continue to work on those and keep everyone posted. With that, let's jump into our numbers update today, and then we'll turn it over to Dr. Wooten for her update. We'll start first with our T3 strategy, test, trace, and treatment slide as our first one for today. Today we're reporting 7,607 tests conducted. That is slightly above our 7-day average, which we have been, again, continues to be in a very strong position of 7,434 tests, our 7-day average. So we're above that. Additional contact tracers, we're now at 474 contact tracers. Today we surpassed more than 400,000 tests that have been reported countywide. We also surpassed more than 20,000 investigations that have been performed, along with more than 1,000 individuals who have received help in our county public health motel rooms. The next slide we'll look at is our COVID-19 percentage positive. Yesterday was probably the single worst day we've had. Today was much better. Today we're reporting 264 new cases out of the more than 7,000 tests performed for a 3% average. So again, yesterday, today, we look at the rolling average, and you can see the purple line there. It's gone up significantly since the middle of June. That's the line that we want to see come back down and hopefully remain stable. Daily hospital census on the next slide, you can see right there in the orange is our COVID-related and ICU. COVID-related was down just a little bit. Non-COVID-related was up, and so day-to-day, we are up a little bit, 479. In the next chart, you can see where that 479 is relative to the total hospital census, the total hospital occupancy or utilization at 4,023, both COVID and non-COVID beds in use. Next one is our ICU, again, holding steady there, right around 71% occupied. Our COVID numbers went down just a little bit yesterday to today. Non-COVID went up a little bit, but our ICU utilization is holding steady. And it is important to once again remind that hospitalizations tend to be a lagging indicator that comes several weeks after a significant uptick in cases. That concludes my section of the report. I'll now turn it over to Dr. Wilma Wooten for her public health officer's update.